Hi friends, good evening. I'm Dr. Ashutosh Gupta, and I practice in Delhi, India, right? And the neighboring state to Delhi is in Haryana, right? So I've been looking around, and every 6 months there is a news which gets published into the newspaper regarding a baby being born, all covered in a fishy scales, which is could be a Collodion baby or a mild Herculean ichthyosis. So this is a sort of a defect, which is an enzymatic defect. So this is an autosomal recessive, and this sort of an belt, which is a Mewat belt, and this Haryana region. I believe that they should be the both the couple, both the father and the mother, and the husband and wife. They should be carrier for this autosomal recessive gene, right? And therefore, every now and then, every 5 months or 6 months, you get to know this news about this baby being born like a fish, and therefore sort of an it gets sort of an to the nerves of everybody, that how we are not able to pick it up, right? Even though we don't do the prenatal diagnosis, but how come that on ultrasound that probably we are not able to pick up an Collodion baby, right? So today I'm going to show you how antenatally this Collodion baby looks like, right? And then probably we'll discuss about all this. So look very, very closely. Okay, so these are the eyes, and then we can identify the eyelids. Both the eyelids, they are bulging. Then we are going getting on to the fish-shaped mouth. Okay, so which is called as an eclabium. So this is an eclabium, right? We can identify the huge sludge which is there in the amniotic fluid, right? And therefore we see both the eyes, and therefore we are having these ectorpion, right? So this is how the baby looked like after the baby was born, right? And this is how it might even look. Okay, so these are the Collodion babies. They look immediately post. So this is an autosomal recessive condition, and depending upon the background frequency of this thing, and both the husband and wife, they coming together, and if both of them they are the carriers, and therefore 25% could be the risk that the baby can be affected. So an affected baby might look like this antenatally, right? Okay, so this is what we picked it up, and therefore we identified that it was a bilateral ectorpion and an eclabium, and then there was a huge amount of sludge which was there in the amniotic fluid, because then all those fishy scales, they were getting sloughed out and they were getting collected into the amniotic fluid, and then we identified that the hands were also contracted. So this is how we probably picked up a prenatal diagnosis of an Herculean or a Collodion baby, right? And definitely after the baby was born, the baby looked like this, right? And so there are a lot of things to talk about. So this is an autosomal recessive condition. So even though we could have done some carrier screening to both of the parents, but usually we don't do that. Ideally, the carrier screening should be done to both the husband and wife, so as to identify which of the genes are being they are the carrier for which of the particular genes, as a matter of fact, but probably unsuspecting. And if she is being into very early into the marriage, and this is her first pregnancy, and therefore until unless, so this is something probably what we can offer them after this baby is born, and therefore this whole workup and genetic workup could have been done. But the whole idea is to identify this, how this Collodion baby looks like on an antenatal period, right? So we need to have a watch very, very watchful eyes to see this bilateral ectorpion, eclabium, huge amount of sludge which is there in the amniotic fluid. We can have contractures, even though we can have an hypospadias also, right? Thank you very much for your patient listening.